Hi, I am Lodhi. Today we're going to talk about magnesium. It is a very important mineral, but often overlooked in regular life and not much discussed. So we'll talk about it briefly, about its highs, its lows, and how we treat those problems. Let's begin. Along with potassium, magnesium is the other spark of our body. It guides our body to run smoothly. It's very important because extreme elevation or drop of magnesium can cause significant life threatening problems as well. So it controls our muscles along with potassium. It helps the muscles relax and release tension. It keeps our nerves working correctly and spark and fire exactly at the right time so they don't misfire. And very importantly, it helps manages the rhythm of the heart because heart muscles is very sensitive to magnesium levels. Both high and low levels can cause big problems. So magnesia is a region in Greece. That's where the term magnesium comes from. Okay, and in lab tests and in calculations and in medications, it's often mentioned as Mg, that is short for magnesium. And it's recognized in every language most of the time when it's written as Mg to keep it scientifically consistent. Why do we need it? We need it for our muscles, as we mentioned earlier. We need it also in our bones because calcium's metabolism and parathyroid hormone, as we discussed in last video, needs magnesium to work appropriately. And very importantly, we need it for our heart. We check magnesium as a part of blood test. Okay, it's called serum magnesium levels. It's usually a part of almost all blood work, including comprehensive metabolic panel and also sometimes renal function panel, but it can also be ordered separately. Sometimes we also check magnesium levels in the urine when we have trouble with high magnesium and low magnesium to see if the kidneys are holding it on or they're wasting it because of reasons that we'll discuss in the next coming slides. Normal magnesium levels in United States are anywhere between 1.7 to 2.4, and internationally it is measured in millimoles per liter and can have a reference range of zero point 0.7 to 1.0. But in the United States, mostly we look at the numbers between 1.7 and 2.4. So balance is very important. We need to keep these levels between 1.7 and 2.4. And even if it's 1.6 or 2.5, it's not much of a difference. But very extreme elevations, anything above 3.5 to 4, or very suppressed levels like near 1 or below 1, that's where the dangerous consequences happen. And first, we're going to talk about problem with low magnesium. So what happens and what causes magnesium levels to drop? So most common causes are diuretics. Many fluid pills, they make our kidneys dump magnesium into the urine so the magnesium level drops even if you need it. Okay, if you have very poor nutrition or if somebody is a heavy alcohol drinker, they also have very low magnesium levels because they don't take in much magnesium. Sometimes if you have malabsorption like irritable bowel syndrome, Crohn's disease, ulcerative colitis, tropical sprue, or excessive diarrhea because of any reason, magnesium is lost from your gut. Your body does not get the time to absorb it from the food and the medications that you're taking. Uncontrolled diabetes can cause low magnesiums, and some medications that are very commonly used, like acid blockers, like we call them pantoprazole or omeprazole, they reduce the acidity in the stomach. A lot of times, magnesium's absorption from the food needs the stomach to be a little bit more acidic. And because of these reasons, you can have deficiency in magnesium as well if you take those medications. So it's important to monitor magnesium levels if you're taking fluid pill, if you're taking acid blockers, if you have uncontrolled diabetes, or if you are acutely ill with diarrhea or chronic diseases like malabsorption. Next, what happens when the magnesium level is low? So we discussed what magnesium is important for, and the problem happens with the same organs. Your muscle gets cramps, it can get tremors, they can get jittery like this, they can be flaccid, they can be limp because the nerves are not triggering the muscles to move. You can have numbness and tingling, and in extreme low conditions, you can have heart go into erratic rhythms and even can go into cardiac arrest. That is when it becomes really dangerous. What do we do when the levels are very low? In slight decline in levels, we can give you magnesium supplementation. But sometime very important factor to note is if your magnesium is slightly low and you take it upon yourself and go and buy magnesium citrate from the supermarket, magnesium citrate is a laxative. It does not work as a magnesium supplement because it will give you more diarrhea. Hence, you will lose even more magnesium and it can be a spiraling cycle. So, it's very important if your magnesium level is low to discuss with your doctor what kind of magnesium supplement you're going to take. Don't just go to the supermarket and pick up anything that causes magnesium on it because sometimes they actually are laxative and it can make the problem worse. So we usually use food supplements and typically prescription supplements to replace your magnesium levels. If it's terribly low, like in low ones and below one, then it has to be replaced IV because if we don't correct it fast, we can cause life-threatening heart problems. Now let's talk about what happens when the magnesium is high. So high magnesium can happen in certain situations, like if you have kidney failure and you are using a lot of magnesium supplements and not able to get rid of it, it can cause very high magnesium levels. It can also happen if you use laxatives and antacid that has magnesium in it. It can also happen in a hospital setting if you're given more magnesium than you were needed. In very rare circumstances, we try to use high magnesium levels in patients who have conditions like preeclampsia. It happens in end of pregnancy and it's one of the complications of pregnancy. And those are unique situations in which high magnesium levels are needed to treat the seizures that can develop. So high magnesium levels will cause similar problems, but in an opposite way. So low magnesium levels can cause jitteriness, but high magnesium levels actually slow your muscles down. It can cause confusion, it can cause muscle sleepiness, and because heart is also a big muscle, it can also make your heart slow down and cause it to beat less efficiently and also very slow. So treatment for it is reverse the causes that have caused it. So if you are taking medications that are very high in magnesium, we stop those medications like laxatives and antacid. We sometimes give you IV fluids to make your kidneys flush out the magnesium in your body, and that helps recover it very fast. We also sometimes give you calcium to protect your heart in case the magnesium is very high because it can cause the heart to go into arrhythmias. And if your kidneys are not working and your magnesium level is very high, then usually in those circumstances, the only choice we have is to do dialysis and clean the blood with dialysis to get rid of all the extra magnesium that you have. So in summary, the balance is very important. The green zone is between 1.7 and 2.4. If the magnesium is very low, like in low ones or below 1, it can cause you to have jitters, cramps, tremors, and needs to be fixed. If it's very high, it can cause everything to slow down, including your heart and your muscles, and can go flaccid and can cause cardiac arrest. So keeping it between 1.7 and 2.4 is important. Slight drop around 1.5 or slight elevation around 2.6 is not usually a big deal. So it is very vital to maintain your magnesium levels. Usually your body does a remarkable job in maintaining it on its own, but sometimes it needs external help, and that's where the doctors and the medications come from. A simple blood test can help us assess where the levels are, and your doctors usually keep an eye on it, especially if you take medications like laxatives, antacids, acid blockers that can cause your magnesium levels to go up and down. We keep a keen eye on your magnesium levels in those situations. If you have gastrointestinal disturbances like diarrhea, malabsorption, magnesium monitoring is also very important in those cases. So I hope this sheds some lights on a very common but forgotten mineral, magnesium, and helps you understand its highs and lows and how we fix it. Very important to know, don't use magnesium citrate because it can cause more problems. I hope it helps. Thank you very much. See you in the next video.